name is Carrie Bladorn. I'm the owner and program director of Eggspecting, Inc., an egg donation agency. I'm also a multiple-time egg donor. Today, I would like to talk to you about the potential risks, side effects, and complications to the egg donor during the egg donation process. Although the risks to the egg donor are minimal, prior to beginning any egg donation cycle, it is highly recommended that the egg donor seek out the advice of her physician and discuss the potential side effects, complications, and risks associated with the egg donation process. An egg donation cycle will require many doctor's visits, blood tests, and vaginal ultrasounds. Each of these are common throughout the duration of the cycle. There are no known risks to having blood drawn except for possibly some mild bruising. The vaginal ultrasounds may be mildly to moderately uncomfortable. During the suppression and stimulation phases of the egg donor cycle, the donor will be taking many different medications, including birth control pills, antibiotics, and injectable fertility drugs. Some potential side effects of the fertility medications to consider are mood swings, headaches, allergic reactions, pain, redness, swelling, and possible welts at the injection site. Also, stomach pressure, bloating, and nausea. The egg donor is also advised against strenuous exercise or extreme activities during the stimulation phase of the cycle, as these can potentially cause torsion or twisting of the ovaries, resulting in severe abdominal pain. In very rare instances, egg donation risks can include the development of ovarian hyperstimulation syndrome, or OHHS. OHHS occurs in less than 5% of all egg donors and occur with different levels of severity. It can lead to enlarged ovaries and an increased chance of developing blood clots. In even rarer cases, it can lead to fluid buildup in the abdomen, lungs, or cause kidney failure requiring hospitalization and potential drainage of the fluid. In extremely rare cases, the enlarged ovary could rupture, thus requiring surgery. All of these OHHS situations can lead to the loss of one or both ovaries. Not all cases of hyperstimulation will require significant medical attention. I myself have been slightly hyperstimulated during one of my many donor cycles. The slight hyperstimulation caused me to become nauseated. I was very bloated and uncomfortable during the week leading up to the retrieval, and for about 7 days following the retrieval. But once my swelling and bloating subsided, I felt good as new again, with no permanent or lasting effects from the slight hyperstimulation. I went on to successfully donate many more times following this instance of hyperstimulation. It is very important to attend the post-retrieval follow-up visit with your fertility physician, even if you did not experience any problems during the cycle or after retrieval. The risk of hyperstimulation decreases significantly when the retrieval occurs as planned and the follicles are aspirated. The aspiration of the follicles occurs during the transvaginal ultrasound guided egg retrieval. The donor is asleep under mild sedation during the retrieval. The donor may experience mild cramping or mild to moderate discomfort when she awakes from the retrieval. Some risks of the actual egg retrieval procedure include complications associated with anesthesia, bleeding, infection, and injury to the blood vessel or bowels. There's also a risk of unwanted pregnancy due to the fact that all the eggs present may not be harvested at the time of egg retrieval. If the donor were to engage in unprotected sex in the days following the retrieval, it is possible for the donor to become pregnant. Egg donation is a relatively new procedure, and no definitive studies have been able to link egg donation to any long-term effects with infertility, cancer, or other significant health problems. There may be also additional egg donation risks that have presently not been identified or not covered here in this video. If you have any questions about the risks of egg donation, please contact your OBGYN or a fertility clinic in your area. My name is Carrie Bladorn of Eggspecting, Inc., and thanks for watching.